Good morning everyone. Myself Dr. Geetanjli Chawla, Assistant Professor from the Faculty of Physiotherapy, RPIIT Campus, Karnal. Welcome to our YouTube channel, that is RPIIT Academics, and if you like the content of our video, you can also like and share them, and do not forget to hit the subscribe button and bell icon for the early notifications of our videos. So today we are going to learn about the Glasgow Coma scale, that is GCS. It is used to check the consciousness of the patients in the ICUs generally. So in this we check for the three things. We check three things: eyes, verbal response and motor response. So if we talk about eye opening response, it has 4 gradings. We name according to the score which the patient gets. If the patient responds spontaneously, very good, then we score him as 4, and if he responds only on the verbal stimuli, then we score him as 3, and if he open his eyes only to the painful stimuli, we score him as 2, and if he does not responds to anything of them, we give him 1. So this is about the eye opening response, and then we go for the verbal response. If the patient responses very well, he is very well oriented and converses normally, we grade him as 5. If he is coherent but disoriented or oriented means if the patient is able to tell the person, place or time where he is, who is the person standing next to him, what is the time, what is the which is the place he or she at, then we say if he is oriented or disoriented. So if the patient is oriented and converses normally, we grade him as 5. If he is coherent but disoriented, we grade him as 4. If he uses inappropriate words as a response, we grade him as 3. And if he responds in incomprehensible sounds, then we grade him as 2. And if he does not respond to our stimuli, if we get no sounds as a response, then we grade him as 1. And in the motor responses, if he obeys command, then we grade him as 6. If he responds localizing to the pain only, then we grade him as 5. And if he responds with a withdrawal to pain, we grade him as 4. If he shows abnormal flexion to pain, we grade him as 3. If he extends his or her limbs to painful stimuli, we grade him as 2. If he does not respond, he does not do any kind of movement, we grade him as 1. So in total we have the 15 maximum scores, that is eye has 4, verbal has 5 and motor has 6. So in total we have 15 scores. We grade him as according to the score. If the patient has the score between 8 to 13, we grade him as the good, as a good score. And if he gets maximum score, that is full 15 out of 15 scores, then he is fully awake. And if he gets less than 3, we call it as a high grade traumatic injury. And if he gets between the 8 to 13 is the mild one, 13 to 15 is the mild one, 8 to 13 is the moderate, and less than 3 is the deep coma, and 3 to 8 is the severe one. So that is the scoring of the Glasgow Coma scale. If we cannot because of any restrictions, we are not able to check any response of the eyes, verbal and motor, then we mark it as T. So if I give the example, we give the Glasgow Coma scale scoring as E3, V4, M6 for example. And if we cannot check, we will let's suppose we cannot check the verbal response because of tracheostomy, then we will grade him as E3, VT, M6, VT. That means we cannot check the verbal response, he is on the tracheal tubing. So if a person scores between the 3 to 4, then 85% of them die generally. The maximum score is 15 and the minimum score of the Glasgow Coma scale is 3, and it is used to check the consciousness of the patient. Thank you. In head injuries, obviously in the head injuries. Okay, thank you.